Those numbers demonstrate the disastrous impact of the pandemic, but there's also another COVID-related crisis looming. Looking at past experiences from the 2008-2009 recession and the Fort McMurray wildfire, a new forecast by Deloitte reveals up to 10.7 million more Canadians will visit a doctor for mental health issues after this year. Joining me now from Vancouver is psychiatrist Dr. Shimi Kang. Dr. Kang, 10.7 million is certainly a staggering number, and the majority of those patients will be women. Why have they been disproportionately impacted during this pandemic?
Well, Omar, like the study shows, 2/3 of the women are experiencing financial and economic loss, and that's a big factor. But we also know that women are more likely to be vulnerable to mental health issues for a variety of reasons, whether it's biological, caregiver role for young parents or elderly, socioeconomic disadvantage, of course, increased rates in domestic violence. And when women do go see health professionals, they often present with things like headaches, back pain, they're misdiagnosed, and there's greater amounts of stigma. So a lot of different factors there.
It certainly is such a challenging time for so many, especially as parents and children are thinking about back to school in a few weeks. What's your advice to help them cope?
I think at this point, we definitely want to get some very practical solutions in place, meaning if you have to wear a mask, and masks are recommended, a lot of young children and adults are experiencing anxiety. So really take the steps, practice wearing a mask, learn how to breathe deeply and calm yourself if you are experiencing that. Practice social distancing, really role play. That's a very helpful technique to become comfortable with something. And then all the basics of self-care, especially going into the new school year, routine regular sleep, routine regular movement and exercise, really priming yourself for this big change that we're all about to experience.
Great advice, Dr. Shimi Kang in Vancouver. Thank you for your insights.